So the Dementia Hit is big. It's the monster hit. And I think an important question came up this morning. Does that mean about funding, or does it mean about people? And it's about people. There's so many stakeholders involved, because delivering dementia care and dementia services is very complex and involves many, many different stakeholders and different services. And we have representatives from all of those on our directors panel. What we've done is we've broken down our workload into chunks, and that's the chunks. So we cover everything from transforming care to research and patient public involvement. The directors for each of these work streams, there's 2 directors for each work stream, and the directors are taken from right the way across the board of all the different stakeholders, so it's truly representative, which is excellent and helpful. Our successes then, so one of the most important things I do want to mention that's not on the slide is back in 2013 there was a requirement to set up steering groups for some of the dementia boards, and the dementia boards are responsible for steering and overseeing delivery of dementia services in the area. And Bristol and South Gloss have set up those steering groups, and the HIT work directly with them. So the work that the HIT does feeds directly into those steering groups, so we do have an influence on how dementia services are delivered in the Southwest. There was a Dementia Hit event, actually. We had a big celebration event, and that was last October. That took place in Bristol. I'm just trying to think, it was a cricket club, yeah, I went to that. And we had things like TED Talks. We had Dr. Phil Hammond off of the telly. He was doing a few kind of interactive sessions with us as well. And it gave us an opportunity to showcase the work that we thought that we were doing quite well. We've had a couple of successful Clark applications as well, so we've got 2 programs of research going on in post-diagnostic support and 1 in avoidable admissions, which for dementia is quite important and top of the list. The research area, that's my background, I'm a researcher. There's a large global study called the Tomorrow Study, and there's another study called the MAID study that I'm working on, but the Tomorrow Study I used to work on, but not so much now. What that is looking at, it's recruiting thousands of people from all over the globe in lots of different countries. It's healthy volunteers, and they're looking for a biomarker. They're particularly interested in looking for a triplet of genes that they think may be a biomarker for an early indication of how likely you are to develop dementia over a 5-year span if you have mild cognitive impairment. So that one's ongoing now. The MAID study that I'm working on, we're looking at a currently licensed antibiotic that's off patent, so it's cheap and available and safe. It's very active in lipid environments. Your brain is very fatty, and we think that it may slow down the progression of memory problems. And we're recruiting people just in the UK on that study, and we're doing a 2-year follow-up. So I'm heading up that study for AWP. We've also got web pages. Now, web pages for each of the work streams that were on the first slide. Bit of a challenge because there's so many of us, and we're all involved in our own bits, and trying to actually grab all that information and keep it current and relevant and stick it all up onto the web is quite difficult. But that's something that we really do try and keep on top of because it's important. A draft dementia workforce strategy. There is a big document that's just been drafted. And I think from my colleagues that's about to be finalised. Patient public involvement, we all are involved in patient public involvement, and it tends to be these tiny little bits of activity depending on what you're doing, and we're trying to bring that together, make it more cohesive. We have a part-time, a few hours a week, PPI coordinator. She's funded by Bristol Health Partners, so we're quite lucky. We've actually got somebody dedicated to bring all of our PPI work together. And challenges, probably all very familiar to all of you. I know working for the NHS, where a lot of us are on fixed-term contracts, you get a huge churn of staff, a big turnover. People that work with the HIT have already got very busy lives. there's never any money, so you tend to lose people very quickly, and again, keeping on top of that is quite a challenge, and finding new people that are prepared to invest their time to work with the HIT is quite hard. We actually have two overarching directors for the whole HIT, and we've just lost one, unfortunately. She's going abroad, and we need to find somebody to replace her, so we haven't done that yet, so keep that in mind. We were talking this morning again about the reliance on goodwill, and even though I've not been with the HIT for long, what's really struck me, or hit me, as I ought to say, is how enthusiastic people are and how passionate they are about wanting to streamline the services and deliver it as the patient wants it. And everyone seems to be very passionate about that. And there are some big personalities, some people with very strong views, so meetings can get quite interesting. But it's good that we have that interest. It's better than the other way around, and it's just harnessing that and keeping it going, keeping the momentum up. And the website, like I said, always a challenge. What have we got in the future then? So we have something called the Bristol Dementia Wellbeing Service. That's an amalgamation of the Alzheimer's Society and Devon Partnership NHS Trust. And what they do is they've streamlined the services for delivery. They have something called Dementia Navigators. There's 23 Dementia Navigators. So if you have a diagnosis and you go back home and you go back to your family, what do? Where do you go and get access to all of the services? Those Dementia Navigators will work with you personally and take you through the whole gamut of services, so you get what you need. It's a very personal service. That has been going for quite a couple of years now, and it needs to be evaluated, so that's one thing that we have to do. Working with other HITs, this came up again a lot, I think, as we noticed there's a lot of overlap. There's obviously overlap with SHINE, with dementia-friendly communities, so that's conversations that we need to have and take forward. We'll have to expand and formalise our PPI capacity. We're writing articles, we're trying to get things published. Got to replace our co-director, like I just said. And the most painful bit, and I think this is something that I'm going to be working on, I don't know why they've chosen me, but I'm going to have to look at the strategy review and try and work out and try and measure somehow whether we're delivering what we said we were going to deliver, and whether we ought to kind of focus down a bit and try and make that decision and say, well, maybe we shouldn't be trying to do all these things and fix the world in a few years, but just pick out the bits that we know are working and that we can kind of evaluate and measure and focus our efforts and time and money on those. And I think that's pretty much where we're going to take it. So I think that's it from me. Yeah.
Great.
Okay. Thank you.